Hey everyone, it's Dr. David here from El Paso Manual Physical Therapy. I'm going to be talking about 3 critical components necessary to fix a rotator cuff tear naturally without surgery, get it to where you can pick up things again and sleep on your shoulder and not have any issues with a re-tear later on. Let's make sure everything's working here. We're trying a different time slot. We got a few comments coming in already. Can you guys that are with me right now live just comment and say I can hear you, or give me a thumbs up if you want to say where you're from? That's really nice too. And then I just want to clear my audio. It looks like it's all working just fine, but the ultimate feedback is you guys telling me that you can hear me. In the meantime, let me tell you what I got back here. So rotator cuff tear, 3 key recovery components. I'm going to demonstrate them with you. I'm keeping an eye on my comments here. There we go. Eddie Morales. Fantastic. Just takes a minute to come through. Thanks, Eddie. Appreciate you can hear me. Lindsay says, hear you in New York. Fantastic. Great. Peg M gives me a thumbs up. Thank you guys for letting me know you can hear me. All right, we're live on Instagram. Can't see I can't see your comments on Instagram, but I can see your comments from YouTube and from Facebook. We're live on Facebook and YouTube as well. Elizabeth Hill says, listening from Sydney. Oh, Australia's in the house. Fantastic. And then Peg's in Colorado, just up the road from us here down in El Paso, Texas. All right, fantastic. Let's get into it, guys. So I'm talking about rotator cuff tears. Lots of cool research is coming out in recent years, really like the past decade or a little bit more than a decade, probably like 15 years, where they're comparing healing a rotator cuff tear without surgery and doing what they call conservative treatment. I use air quotes because there's different definitions for that. Conservative treatment is usually physical therapy. So there's a variety of treatments you can do in physical therapy. But what they found whenever they compared conservative treatment for a rotator cuff tear and a rotator cuff repair surgery is that both groups in research studies get better about the same amount. So then it raises the question, do we even need a rotator cuff repair surgery if you have a rotator cuff tear? How do you heal it without surgery? That's the big magic question, because where we're not clear is what needs to be done. What components of recovery need to be in your treatment plan so that you make sure that you treat your shoulder properly and your rotator cuff can heal and you're back to doing activities you want to do. Great. Who else is here? Coral from Austin. Oh, fantastic. Go hook 'em horns. I am a Longhorn. Who else is here? Listening from Gaithersburg, Maryland. Cleo. Hi, Cleo. Sharon McCann is in the UK. We're all over the world today. I love this. Ron is in Pennsylvania. Awesome. Alice is watching us from the Philippines. All right, we got 4 continents covered now. We're in Europe, North America, of course, Australia, and Asia. Peg M says 2 failed shoulder surgeries. Oh no, is there any hope for me? I refuse to get a slap, a superior labrum, anterior posterior. That's a certain kind of shoulder injury, a repair, I'm guessing. All right, I think Gabby from Austria is here. Fantastic. All right, I know we got some questions. We'll get to questions, by the way, guys, before we're done. But let's get to this next. So, what's the first component that you need if you're going to be healing your shoulder naturally without surgery? The number one place you have to start, and you have to think about what condition you're in, because if you've had a rotator cuff tear for a while, and the pain's kind of coming and going, it's not what we would call acute, like it's not really irritated or painful, then you may not start here. But when it's irritated and painful, this is what you need. You need one of these things. This brace right here is your typical shoulder brace. Now, this is probably a little bit fancier one. I'll tell you why. But you can find these all over the place. I got this one off of Amazon. We'll have to link up the product from Amazon. I got this one a while back now. They might have updated it. But this is a fancy one because it's got this nice pad right here. It's like neoprene and padded, and a nice little strap. And it's got on the inside here a pocket for your belongings. You know, you could easily fit a phone in there, a wallet, that kind of thing. It's got 2 pockets, actually, one on either side. And it's even got a thumb loop in here, which is really nice. And but you can get a very basic one at most drugstores, pharmacies, department stores, that kind of thing. And here's how you would use it and why you would use this if you have a rotator cuff tear. So number one, how to use it is you need to make sure that your elbow is all the way in the corner. A lot of people wear their slings and it's like this, and there's this flap right here that's just dangling, and it's not being used effectively at that point. You see how much my arm is hanging out, and I'm a bigger person, so these come in one size fits all, and left and right, they're usually uniform. You can use them in either one. But you want to make sure that you pull this right here so that the corner of the fabric is filled up with your elbow. Here's where the thumb loop comes in handy. You put your thumb in there, and it holds your hand up, because if you don't have the thumb loop in, then your wrist wants to hang down like this, your hand, and it starts to bother your wrist after a while. So it's kind of nice to just be able to have a little thing, a little elastic here to hang your thumb from, so your wrist isn't getting in a funny position. Then after that, you're going to get the strap right here. Find it, there it is. And you just pull that strap to cinch it up. And I'll get to the why of why you want to use this here in a second. It's going to make more sense once I'm all cinched up. So I want my elbow to be shoved up by the sling, just like that. So that I'm kind of shrugging. Can you see up here how my shoulder's up compared to this side? Versus if I take the slack, if I put slack on this, take the tension off, see how my shoulder comes down? Ooh, I unthreaded it all the way. But when you have that shoulder shoved up like that, let me get my rotator cuff model here, because I need you to be able to see what's happening in the shoulder. This is the right shoulder here. When you have that sling all the way up like that, and it shoves the ball into the socket, and here on this shoulder model, you can see all the red are the rotator cuff muscles. They're all around the shoulder blade. The most commonly torn rotator cuff muscle is the one on top right here, and then the one on front. All of them can get torn though. But when you shove that ball up into the socket, then you take tension off the tear where the rotator cuff is. And what you're doing with the edges of the tear is you're bringing them together. Now, I don't have any research on this. I can't tell you that, oh yeah, this was found, 10 years ago, or even last year, this year. This is just my clinical experience. This is my expertise that I'm giving you. But consistently, like every patient that I've ever told to wear the sling for a rotator cuff tear, they're like, well, that makes sense. You're bringing the edges of the tear together. And then when they get in the sling, they're like, oh, it's immediate relief. And it makes sense, because you're bringing the edges together and you're giving the tear a chance to heal. And you just need to be like that for a while. Now, I don't have hard numbers. It's going to be based on how severe your tear is. I can't tell you if it's a partial tear or a full thickness tear. There's a difference in effect. But consistently, I have people feel better once they get that elbow up. Now, some modifications that I'll make with people is I'll tell them, you want to have this on pretty much all day. But if you do have like a desk that you're sitting at, or a chair with good armrests, or perhaps if you're driving, basically somewhere where you can rest your elbow and even put a pillow under to get it up, because that's the idea, is you want to take tension off the shoulder by elevating your elbow like this up into your shoulder. It just relaxes everything when you can do that. You don't want to lean into it a whole lot, because that could put bad tension through there. But if you can just take that tension of gravity pulling your arm down and pulling the edges of the rotator cuff tear apart, it makes a huge difference and can make people feel so much better. So that would be the number one key recovery component that you need to be implementing. It's use a sling. With that sling, you're putting yourself in a position to heal. That's like step number one. And I have never met a healthcare professional that has recommended that to patients. And I don't know why. It's the equivalent of like if you sprained your ankle, or if you had knee surgery, you would be on a walker. You would be on a crutch, on crutches. If you sprained your ankle, right, you would want to put weight through that ankle because it hurts to put weight through it. Your arm's not a weight-bearing structure usually. You're not walking on your hands, but gravity's pulling down on it, and if you could take pressure off or tension off that area where it's torn, it's probably going to feel better. And I find that consistently happens with my patients when we use a sling. So number one thing, get in that sling. It's going to make the world of a difference. And this is good for other things like labrum tears, virtually anything that's structural, any structural problem in the shoulder. Obviously, after you have a shoulder surgery, they give you a really big sling and they instruct you to wear it all the time. So that's where I got this idea from. I was seeing people that were doing rotator cuff surgery, rotator cuff repairs, and they were in this sling, and the doctor had all these protocols for being there for 6 weeks, only get out of it when you take a shower, sleep in the thing. They have all these requirements. And it makes sense because that surgeon just operated on the rotator cuff and they don't want to mess up the surgery because then they have a failed surgery and the patient's going to be in pain and have problems again. So I thought, well, why not just wear the sling before you have the surgery and see if it'll feel better? And it worked. A lot of patients were feeling better by doing that. All of my patients were feeling better. So I highly recommend this. Best $20 you're going to spend to prevent a shoulder surgery. And that's the high end. You could probably find these for 10. All right, hopefully that helps you guys. Let's talk about component number 2. It's going to be a more commonly found one in physical therapy, but this deal right here, this is a shoulder sling, and these cost between $10 and $15 as well. They're about as much as the sling. This is a pulley. Sorry, I might have said sling. And it's just a rope with handles and a pulley on the rope. I'm not going to open this one. I have this other one. There's different brands, different styles out there. But all of them are set up so that you can hang them off of a door or tie them up somewhere. And I'll show you why they're so important in a second. Let me just show you what this looks like on camera. Oof, it's all tangled. So there's the hook. This would go over your door. You close the door and you can imagine it. Let's see if it'll hang here. Yeah, it'll hang there. Just can't pull too hard. And then you would put a chair in front of the door, sit down, and you have the rope to move like this. And which the idea is you're using your hand on the shoulder that's okay, the one that isn't hurt, to assist the other shoulder going up, the one that's painful. So usually with a rotator cuff tear, you can't raise your arm without pain because your rotator cuff muscles are involved in raising your arm up. But if you get it to help, if you give it help with your other hand using this pulley system, then it's all of a sudden painless to come up. That's really good because then you can move the joint. And this is all commonly taught in physical therapy. Most doctors out there, surgeons that are doing rotator cuff repair surgeries will recommend a period of time using this device. And I think it's fantastic. Where I've modified things though, because I do things different than typical physical therapists and the healthcare field in general, I kind of deviate from a lot of things that they do. Where I modify it is before I take people to this, I teach them about the rule of the hand. This is important. So this is kind of like 2B, if you will. In fact, I'll write it out here. 2B, rule of the hand. And it's so important because if you don't do this while using the pulley, and then every exercise after this in rotator cuff repair, in rotator cuff tear healing, you're going to hurt your shoulder again. You're going to set yourself up to re-injure your shoulder eventually. Maybe you'll make some improvements gradually just because your body wants to heal itself, but you're not helping the muscle imbalance, and that's going to set you up for a re-injury later on. But if you do the rule of the hand, then you should be fine. You should not be re-injuring yourself pending any like crazy traumatic issues like an accident. But a non-traumatic injury, like it just starts hurting all of a sudden, you didn't have a fall or an injury, that's what we're fixing here. So the rule of the hand is this: wherever your hand goes, your shoulder blade should follow. So if you're reaching forward like this, like if I'm going to reach for the edge of the flip chart here, my shoulder blade back here should move forward on my body proportionally. So if I'm reaching forward a little bit, then my shoulder blade should move a little bit. But if I'm reaching forward all the way, then my shoulder blade should reach forward all the way. And then the same is true when I'm reaching up. If I'm reaching up, usually I tell people the threshold that I've followed and it seems to work just fine is once your hand starts passing like above your eyes, you need to start to shrug your shoulder blade up. And as you come all the way up, it should go up proportionally. By the time you're fully reaching up, extended, your shoulder blade should be shoved into your ear. Just don't tip your ear to your shoulder. You want to bring your shoulder up to your ear. which is a mistake I see people do all the time. When you have weak neck muscles and you start to shrug, your head just wants to go over that way. So keep your head stable and then shrug the shoulder. Now that's forward and up. What about back? So if you're reaching towards your body like this or behind your body, then your shoulder blade should be pinching back on that side. Once you wrap your head around this concept and you play with the motion, you start to practice it and you move it into your practical life, like you're reaching for a doorknob, you're reaching for a cabinet up high, you're coming towards your body to adjust your hair or something like that, giving yourself a shower, reaching behind you in the car, and you move your shoulder blade appropriately, it feels natural. It begins to feel like the way you should move because it is biomechanically the way that you should be moving. So once you nail that part down, then you're ready to bring it into the pulley. And it begins to make sense then if your shoulder has pain when you're reaching up here, without the pulley sometimes, I tell patients, just shrug right there where it starts to hurt. Just raise your arm up. I know you have a rotator cuff tear. Raise your arm up to the edge of pain, and they'll say, okay, right there, it starts to want to hurt. I say, okay, now shrug your shoulder. And they'll say, oh, the pain went away. And I can go a little further. Now it starts to hurt here, and look how much higher my hand is. And I have to explain to them, it's because we're following the rule of the hand. You're biomechanically moving your shoulder better. And just to describe better what that means, is your shoulder blade has the ability to move up when you elevate them like this, when you shrug, and it also can rotate upwards like that. The socket faces outwards like this, and the ball, whoops, making a mess. The ball sits on the socket like this, so when you shrug it up, you do that, and then when you rotate it up, the socket faces upwards, which just creates the best mechanics possible in the ball and socket of the shoulder. And so you're putting the right tensions, the right pressures through your shoulder. You're using your muscles appropriately to load your shoulder and move everything just fine. But if you keep it down and you just think about raising your arm, but you see how this gap here is still big, you're not doing this right here, then what you're doing is you're forcing your arm bone, the ball part of the ball and socket joint, to butt up into the end possible motion within the socket, and then you start pinching tissues and putting bad pressures to the rotator cuff. And so you're ruining the mechanics of your shoulder essentially. So that's the rule of the hand right there. When you start to shrug while using the pulley, and you practice every time you come up, shrug, hold the shrug until you get back down to the top of your head, then fully relax it. And I tell people practice both sides because your other side needs it as well. If you haven't done it on your injured side, your uninjured side is going to eventually have problems if you don't get this down too. But using this thing until you don't need it anymore, that sets you up to fully rehabilitate your rotator cuff tear. Because when you're practicing with this, getting an assist, if you can't come up under 100% your own power, your own muscles, and with proper mechanics, then doing it with a little bit of help, with 50% help, or eventually 30%, so you're 30-70, 10-90, and so forth, then you begin to get to the point where you're like, I can reach up, no pain, I can shrug, I don't need the pull anymore. We're done with pulleys at that point. When we reach that threshold, then what we're doing is I transition people into shrugging exercises. This is super important because we've already established rule of the hand. Your wherever your hand goes, your shoulder blade should follow. Oh, and by the way, I said, forward, when you reach forward with your hand, shoulder blade goes forward. When you reach up, shoulder blade should go up. And when you reach back or towards you, shoulder blade should pinch back. The same movement applies for all the in-between motions. So in other words, if you're reaching up kind of forward and up, move your shoulder blade in that direction. So whichever direction you're going in, you should think to move your shoulder blade in that direction. And when you're exercising, you need to do it then for sure, especially then, because now you're moving your arms in that direction with resistance. So it becomes even more critical. So that's where we're going next. The last part is shrugging. And I start people with a wall shrug. Let's see if I have a good angle here. My bike might get in the way a little bit. Yeah, this works. So I'll tell people, put your arms on the wall like this. And ideally, there's nothing in front of them. So I'm kind of leaning away from my bike just a bit. But then you're going to shrug all the way up. And you can see I started to shake there. That maximal shrug right there gets your upper trap muscles to fatigue. because that's what we need to strengthen. If we can get the muscle to fatigue and isolate it as best possible, there's going to be other muscles working. But if we can get your upper trap to specifically get tired, then it becomes easier to follow the rule of the hand, especially when reaching up. And if you can get that upper trap stronger and stronger over time, by progressing this exercise, you start here and you're doing 10-second holds. I start people off with holds because it wakes all the muscle fibers up. All the cells within the muscles will wake up. Then you can increase the angle and shrug from there, eventually all the way up and shrug from there. Then eventually you don't need the wall anymore. You could just reach straight up and shrug right here, but you still have to focus on shrugging because the goal is to train those upper trap muscles. The better you get at doing that, the more pressure you're going to take off your rotator cuff, assuming that it's not hurting doing any of this. By the time you get to shrugging, you shouldn't have any shoulder pain, very little of any, and it shouldn't make it worse. It should feel fantastic. After you can reach up and hold a 10-second shrug for 10 reps or so, and you have no shoulder pain, and you feel comfortable, you trust your shoulders, then you're at the point where you can start to add some weight to it. And I'll start off people with a small weight. This is 5 pounds. I might start them off with 1 or 2 pounds, and even just holding 1 or 2 pounds between both hands like this and shrug up like that. Once you can get up to 5 pounds or 10 pounds total, and you're consistently raising your shoulders, shrugging your shoulders up every time you come up. See how I'm going to do in slow motion. When I come up right here, once my hands pass about my eyes, I'm starting to shrug. Then I'm shrugging more and more until I get to the top. Then I'm shrugging maximally for a moment. And then I'm not letting off the shrug 100% until I get back down to about right here. So in real time, it looks like that. It kind of doesn't look bad in real time. It feels awkward if it's the first time you're doing it. But when you're used to doing it this way, it actually feels normal and natural. You'll feel your upper traps getting fatigued. Most importantly, you'll feel great in your shoulder and it'll feel good on your rotator cuff because that's the way the shoulder's supposed to move. All right, so number 3 here is shrugging exercises. So you have to progress your shrugs. I talked about how you start on the wall with your elbows bent like this, then you walk your arms up the wall. This could take you, at this point, weeks or months to do this. So let's give you time frames. The sling, typically a few weeks, maybe a month and a half. If it's a really bad tear, maybe 2 months. The pulley, you might be here for a month or 2. And this could be anywhere from 1 month to 6 months, depending on how weak you are. This is a strengthening. This is strengthening at this point. Here, this is high pain. Here you can move, so you have kind of moderate pain. Pain with movement is basically what you're experiencing here. Maybe some dull aches and pains here and there, like if you're lying on your shoulder. But here, this is like it hurts all the time to pick up anything. By the time you're here, you shouldn't have any pain because you're starting to shrug and activate the muscles more. So it should feel just fine to do this. It should just be difficult. You can't pick up more weight without sacrificing your form. You want to be able to keep your form up, meaning you can shrug fully every time you reach up. All right, guys, these are the 3 big components. I have a bonus one for you, and this one's definitely a little risky, and I would recommend that you only do it if you're at this point. And I say risky, and I'm being extreme here. It's only risky if you're doing it when you're in a lot of pain. You probably wouldn't do it when you're in pain. Like your body's going to tell you, "Ow, this hurts. Don't do it." So secret one, number 4, is going to be hanging. So this means finding a pull-up bar, and this is more like maintenance, okay? So just to be clear, this is not an acute treatment to do. This is when you're already feeling good, you're feeling strong, then you might start to include this after you've been working on your upper trap strength for a while, your shoulders felt great, your rotator cuff tear isn't an issue anymore, now you're just maintaining shoulder health for the long term. That's when you would look to do hanging. But you can find a pull-up bar. And you would start, if you've never hung before or you don't think you're going to be good at it, start in a way where you can keep your feet on the ground or on a step stool, a platform of some sort of step, so that you're not dangling from your full weight. But the idea is to dangle, to hang, and put tension through everything. So it's distracting your shoulder because that's a good thing for your shoulder. Our bodies are made to hang. We're bipedal. That means we walk on 2 feet, not quadruped like a dog or a cow or a cat. Those animals walk on 4 legs. They don't have arms that they can manipulate like we do. We're closer to apes, right? And apes can hang and swing. They're built to do that, and they do that very well. If you ever look at an ape hanging and swinging around at the zoo or in the wild on television or something, they're built to do that. And we can do that too as humans. We just don't typically do that. I mean, you see like trapeze and, acrobats doing that kind of thing, but you should maintain the ability to at least dangle. You don't have to do flips and crazy tricks, but if you can just hang, it's so good for your shoulder health. That tension is good tension to put through your tendons, your rotator cuff tendons, because it will strengthen them over the long term. It keeps the joint healthy over the long term. But you have to work up to this. You have to earn the ability to do this by working your way through this stuff if you have a rotator cuff tear. When you're hanging, what I would recommend you do is start by hanging for like 3 to 5 seconds at a time. If you can work up to 10 plus seconds, like 10 to 20 or even 30 seconds, it takes effort if you've not done it, because your grip has to strengthen. Just your ability to tolerate the whole motion has to improve. But after a while, you'll be able to dangle for 30 seconds or a minute. And what I would recommend is going like sets of 10, like dangle for 10 seconds, 10 times in a row. And I would look to do this frequently by the time you're recovered from your rotator cuff tear by doing all this stuff. Once you're feeling pretty darn good, I would get a pull-up bar for home, like one that goes in a doorway. Don't dangle your full weight. Be careful. Make sure you have a doorway that can sustain the weight of the pull-up bar and everything. Or go to the gym and do this on a regular basis and just hang for a minute or two. You can break it up into 10 seconds at a time, but super good for long-term shoulder health. I do this multiple times a week, and my shoulders have never felt better by doing this. All right, guys, that covers 4 key recovery components for the rotator cuff tear. I didn't want to include this one in the original list because, like I said, it's definitely advanced. It's for when you're feeling great. It's for maintenance. But doing these 3, using the sling, using the pulley, making sure you're following the rule of the hand while using the pulley, and rule of the hand and the shrug, obviously, because you're shrugging. This is going to take you pretty far in recovering from a rotator cuff tear without surgery. Now, that being said, I gave you a quick overview. I do have a program called the Rotator Cuff Tear Recovery Program, which goes into way more detail, specific progressions. We have all the phases. I have a phase chart. There's a lot more. It's a deeper cut, if you will. I'm giving you the overview, the bird's eye view here, but you can go to our website and check that out if you want to learn more. That being said, let's get into some comments here and see what you all are asking about. Just to let you guys know, I can't see your comment if you're on Instagram. I can, though, on Facebook and YouTube. And I'm going to start going through comments here. I got Jennifer first. But if you want to do a super chat, a super comment on YouTube, I'll answer you as fast as I can. Next one up as soon as I see it on my software here. All right, Jennifer Collins is up first. She says, thank you for all your helpful advice. You're welcome, Jennifer. 3 weeks now, my knee pains feel like it's coming from inside my bone. It's like walking across and stabbing me with a pick. Oh, I'm so sorry, Jennifer. Lots of reasons for that to happen. It could be a meniscus issue. It could be ligament problem. It could be osteoarthritis. If you're having pain while walking and there was no accident. If there was an accident, then I'm thinking right away, you probably sprained something, tore something. You just irritated the joint a lot. That could happen too from an accident. So my advice there would be get on some crutches, get on a walker, or at least a cane. The other thing, though, that if it doesn't consistently hurt, it could be a tibial shift. That's where the shin bone is not aligned with the femur, with the thigh bone properly. And that could cause a stabbing pain deep inside the knee as well. It often causes inner knee pain, like on the inside part of the knee, like closer to where your other knee is, but it can cause deep in the middle of the knee joints as well. I've got videos on all that. I've got our most popular video on YouTube. It's got like 6 million views. It's about fixing a tibial shift because it is such a common problem in the knee. And it's the type of problem that like the pain that you're describing, Jennifer, people will go to the doctor for this and the doctor will say, everything looks fine. I took an x-ray, everything looks good. They'll do an MRI even. They'll say nothing's torn, but you live with that pain. And the doctor's going to be like, well, there's nothing I could do because everything looks good on your scans. Your knee bends just fine. Yeah, it hurts, but I don't know what to do. And what the case is often that I find with patients is their knee is not aligned properly. That knee could come out of alignment. And if in that video, I've got a description on how to realign it yourself. I do this treatment on patients. It's a little different when it's being done to you, but there's a way to do it for yourself, and it can fix a lot of this kind of knee pain. If you look at the comments in that video, a lot of people are commenting on there, this worked, my knee popped and it felt better all of a sudden. And it's confusing because some people have a meniscus tear or osteoarthritis because they went to the doctor for this knee pain, and then they'll do this thing, this tibial shift correction technique that I show on YouTube, and their pain will clear up. And so I always have to ask the question, was it really the meniscus that was hurting them, or the arthritis, or was it the alignment problem? And might that person have had a surgery for their meniscus or their arthritis, and you really just needed to worry about the alignment, and that doesn't require surgery at all? So look into that, Jennifer. Good question. Elizabeth Hill says, I literally just awoke at 3 a.m. in agony, and this video popped up. I feel like someone is stabbing me in the shoulders with knives. I'm so sorry, Elizabeth. Hopefully it was helpful, the 3 components here for rotator cuff tear recovery. Hopefully you can start to implement. Get yourself that sling. Sounds like you're at that level. I tell you, that sling works wonders. It's so cheap too. And like I showed you this, I got this fancy one off of Amazon. You can probably get a really, really basic one down the street from your home, or you can get this one delivered to you depending on how quick Amazon gets to you. But go find a sling, get in that, and that'll probably help you start sleeping better, and then work your way through these steps that I talked about. And if it's right for you, go check out our rotator cuff tear recovery program. In my opinion, that's your best bet. Peggy Estrella says, almost a month ago, I had a fall on the treadmill. Oh, I'm so sorry, Peggy. I hope you're okay, first off. I hope it's comical now. You see all those videos on social media. What's that formula? Tragedy plus time equals comedy. When you, in the moment, it's like, oh, I got hurt. I had to go to the hospital. I was bleeding. But over time, a year later, you're like, that was pretty funny how I felt. I hope it turns into one of those situations for you, Peggy. I hope and pray that you're okay. All right, who else is here? We got Peg M says, 2 failed shoulder surgeries. Is there any hope for me? I refuse to get a slap surgery. I'm broken. Oh, you probably aren't following the rule of the hand. That rule of the hand, Peg, is it's pivotal for fixing the muscle imbalance, because there's several muscle imbalances that happen in the shoulders that lead to slap tears and rotator cuff tears and labrum tears in the shoulder. There's all kinds of problems that happen in the shoulder, but they're all rooted in the same muscle imbalance, which is usually the upper traps aren't strong enough. And because the upper traps help to pick up your shoulder blade, they move your shoulder blade upwards like this, which moves. All right, I switched Wi-Fi's to my phone. Hopefully we're still rolling. Hey guys, can you, we lost power in the building, so our Wi-Fi in the building went out, but I'm running on my laptop power. Can you just mention in the comments if you can hear me or not? Just give me a thumbs up or something. It looks like I'm connected, but I just want to make sure that I'm not talking into the abyss here and that I'm actually still helping some people out. Looks like my camera looks okay. Oh, cool. Lori says you're good. I'm sorry, Lori gives a thumbs up. Steph Scissors says you're good. All right, the show must go on. Let's keep talking here. Let me go back to where I was. One moment. We were on Peg. Okay, so Peg says, 2 failed surgeries. I was talking about the muscle imbalance, Peg. By fixing the upper trap strength, you take tension off the rotator cuff tendons here. So if you get that upper trap strength to assist when you're picking your shoulder up, you'll not put so much pressure to the rotator cuff. So you'll be okay. We don't have any power. Sorry. Yeah, I'm good. Where people are saying they can hear me. Sorry, my staff's checking in on me to make sure we're okay. So Peg, you got to go get upper trap strength. You got to implement the rule of the hand. You've got to make sure that you start doing that. I think that's the hope for you, because surgeons probably aren't going to guide you in that. They just don't know about this stuff. They're all, well-intentioned. They want to help you out. Power's kind of coming on. But they want to make sure that they treat you the best they know. And they know surgery, they know injections, they know medications, but they don't know how to fix muscle imbalances. So you've got to do that for yourself. The lights are flickering here. All right, Gabby says, thank you from Austria. Karen is in Kodiak, Alaska. Fantastic. LePent is in Minnesota, USA. We've got Mississippi Girl. I think that's what that's, Miss Pippa Girl in Florida. And then we've got Keed in Illinois. She says, massive rotator cuff injury. I'm so sorry, Roselle. That's no fun. Hopefully this helps you out as well. Clint Garcia says, my injury was July 13th. Still a lot of pinching nerve pain. I have a complete ligament tear in my rotator cuff, right shoulder. I'm so sorry to hear this, Clint. Since it was July 13th, today is August the 5th, so you're just a few weeks out, coming up on a month. You need to be using that sling like I wrote here. That sling is hugely important. I think you can avoid the surgery. Once you feel like you're able to reach your arm up a little bit, then try out that pulley. You can get that one off Amazon. I have not, the only place I've seen the pulley is at medical supply stores. You might be able to find those. So if you just Google medical supply on like Google Maps or any map app that you like to use, you'll probably find some places in your area depending on how big your city is. But at the very least, you can get it from online sources like Amazon, and we'll have to link in the description a link to the ones that we use. We have a couple different versions. They're all pretty much the same. It's just a matter of how nice you want yours to be. Coral says, I have a labrum tear and full rotator cuff tear and cervical stenosis. So confused. Seems what helps one thing can harm another. This is a good one, Coral, because when we're talking about your muscle imbalance, I just mentioned a minute ago how like rotator cuff tears, slap tears, which is a labrum tear, and there's other issues like biceps tears as well. That lighting looks a lot better. Thank you. All those other conditions they're all rooted in the same muscle imbalance. And it's the same thing with stenosis in the neck. Neck conditions are often related to the shoulder because of that muscle imbalance. When that upper trap gets weak, one of the jobs of the upper trap is to hold the weight of your shoulder and your arm and everything up, because gravity is constantly pulling it down. So if you don't have something to pull it up, that upper trap, then that tension from gravity starts to yank on your neck, because that upper trap connects to your neck bones and the base of your skull. So it starts to compress the skull and can set up stenosis, pinched nerves, arthritis in the neck, disc herniations. It's the same muscle imbalance that causes many neck problems. And no joke, oftentimes when I see neck patients, I'm telling them to do shrugs. I'm teaching them the rule of the hand. And they often have shoulder problems as well. It's just that the neck problem tends to be the priority for them. And that's what's keeping them from sleeping at night. But when you get that elevation from your upper traps, because they're stronger, all of a sudden your neck starts to feel a lot better. So don't get confused on this, Coral. You've got to just really work on one muscle imbalance, and you'll knock over all these other dominoes along the way. But don't get confused on, I need to do this for my neck stenosis, I need to do this for my rotator cuff, I need to do this for my labrum tear, and it's all the same thing. Medical professionals will tell you, well, stretch the neck, stretch the shoulder, then do this for your rotator cuff, banded exercises like this, which don't do those. Those are a waste of time. They're feeding into the imbalance, because your rotator cuff muscles are already strong because your upper traps are weak. They've just become injured because they've been overused. So doing rotator cuff rotation exercises with a band, not a good idea. I hope that helps, Coral. Medical professionals out there are confused about how to treat this. I hope to clarify that it's the same muscle imbalance causing all of those issues. All right, we've got about 6 more minutes here. Cindy is here. She says, I followed your advice a few months ago, and now I'm almost fixed. Thank you so much, Sydney in Wales, UK. Oh, I'm so glad. I hope we can find out what problem you had, Cindy. That way we can get better information about what you did and how this happened. But good job. Who else is here? Mohammed is here from Pakistan. Awesome. VG says, how long since he started the live? I've been going for 40 minutes or so. Elizabeth Hill responded 2 minutes. VG says, great, thank you. All right, here's another question. Asij says, sir, what do I do if the quads get tight every time I do glute or any other exercises? I'm avoiding quads like you taught in CMP. I'm not sure what CMP is. But I understand your question. This happens all the time. You try to activate your glutes, your butt muscles, and then the thigh muscles also get tight. They also want to activate. That's a compensation. That means that your nerves haven't rewired themselves like they need to. Your nerves have adapted to compensate with your quads and your hamstrings potentially whenever you want to use your glutes. So what needs to happen right now is you need to play with the intensity that you're tightening your glutes. So you need to think to yourself, okay, tighten your glutes 10%. And then think about your quads or your thigh muscles not activating. And then see if you can go 15 or 25 or 50%. See how high you can go in your glute contraction on the backside without your thighs working. Once you find that level, that threshold where your thighs want to start to work, then hang out right below that threshold. Let's say you start to engage your thigh muscles at about 60% glute contraction, then hang out at 50, 55% and just hold the glute contraction, minimum 10 seconds. Repeat that 10-second holds 10 times I tell people hourly all day until you can climb up to 70%, 90% and beyond. When you can tighten your glutes 100% and your thighs do next to nothing, you're in good shape, because now you're going to be able to go walk and primarily use your glutes. Now you're going to be able to do glute focused exercises with intensity and not calling your thigh muscles to work. And you won't be feeding into the imbalance that way. So you just got to slow down and get those glutes to be active and more active and hold, because that helps your nerves to better connect to your muscles. Hope that helps, Asij. Who's next? Karen Edwards in El Paso. We got an El Pasoan in the house. Fantastic. Hey, Karen. Who else is here? Lena Music says hello from Canada. And thank you for your helpful hints. You're welcome, Lena. I do this for you guys. Zolaika says, hi, I am from Sweden. Fantastic. Oh my gosh, the whole world is here. We just need Africa to check in, and I think we're good. Like, we've covered Antarctica, but nobody's there really. In South America. We didn't get anybody from South America yet. Keith says, OMG, first thing I asked was, should I wear some kind of sling? Therapist said no. Now I'm post 1.5 year, did 12 weeks of PT at home. I'm so sorry. This is terrible, Keith. Collagen helped a lot. I tell you, they don't think to do this. It's not taught in schools. It's not, I don't know if there's any research out there. I looked a while back. There was no research protocols that showed if you tear your rotator cuff, you should be in a sling prior to having surgery. They go straight to doing, these exercises with the band. Doing the pulleys is something that's commonly recommended too, but there's no instruction on rule of the hand while you're using the pulley and how long to be using the sling. For some reason, slings, in my experience as a medical professional, slings are only instructed to be used if you've got like a broken bone in your arm, which is a structural problem. But so is a rotator cuff tear. That's a structural problem. Something's torn. I would imagine you need a sling. Makes sense to me. Kaylee says, with the sling, what if it sets you off due to a trauma response? I'm trying to imagine what might set it off. If it's like a post-traumatic stress, like if you had some issue with slings in the past or ropes or something like that, then geez, I don't know how to help you with that. That seems like more like you got to talk to a counselor, a psychologist, somebody who specializes in mental health. But if it's like a response in your body that you're not sure, there is a situation where if you have very aggravated nerves, then elevating your shoulder could set things off. In that case, you might need to see a specialist about your nerves. Like, I would go to a neurologist and tell them I'm having this response when I'm trying to do this treatment for my rotator cuff. is this normal? And they might be able to help you out with the neural stuff, because it's not typical. I've seen it a handful of times, but it doesn't usually happen when I put people in a sling for a rotator cuff tear. All right, Lena Music says she's in Sweden. Fantastic. The Swiss are here. Steph Scissors says, hello from Utah. Oh, I've heard Utah is beautiful. I can't wait to check it out one day, especially the slopes. I love skiing. Steph Scissors says, any injury to the shoulder is awful. Absolutely right. It just stops you from doing so much. No fun whatsoever. All right, I got time for one more comment here, and then I'm going to get going, guys. Keith says, also, I took a pass on any surgical intervention. My doctor told me, whatever you do, just don't fall again. So, of course, that's all I think about. What a way to live, right? Like, the doctors kind of leave you fragile. It's like, okay, they just leave you thinking that you're getting older. Don't mess it up. You already messed this up. They leave you thinking it's not going to heal. Just don't get hurt again is their advice. And I'm just like, oh my gosh, we're not fragile human beings. We have the potential to heal, to get stronger, to improve our state, no matter your age. Because, if you're 50 now, you can get stronger and be 55 or 60 and be stronger and healthier than when you were 50, which means it's not an age problem. You can fix this rotator cuff issue. Sure, there's examples where there's cases where you do need a rotator cuff tear. But what I've found is consistently, if we follow this process here, people get better. And if they get to this point, they're like, why would I need surgery? I'm shrugging with weights. When they're doing this, they're like, I don't even think about my rotator cuff tear anymore. I could fall and I'd be just fine. That's where I want you to be there. I think that's what you got to do, Keed. All right, last question here. Brendan Connolly says, have you ever personally seen an instance where once you do your advice, chondromalacia gets worse before it gets better as you deconstrict the cartilage and finally allow it to breathe? No, I have not seen that, Brendan. This is a question of like, it has to feel worse before it gets better. No, I disagree with that thinking, because when something feels worse, it's your body's response to irritation, to injury. That's why you feel pain, because something's become injured, something's bleeding, something's cut, something's smashed for too long. There's tissue that's being destroyed, and your body's wired to treat that as pain. So I personally have not had that experience. Usually I'm doing things that feel better to people. There's one instance where, like, one condition where I can see this happening, but it's not happened to me personally. And that's with central sensitization. That's where your body starts to misinterpret the sensations that you're having and create pain that isn't really there. The tissue's fine, but you're feeling pain. There's a whole field in this stuff, and we see patients here in our clinic with this issue. However, I haven't treated somebody with chondromalacia with this issue. When I'm working with people with chondromalacia patella, we free up the quads through massage techniques, and almost instantaneously that reduces pain a few notches. Then we start working on glute activation, and that takes some time, right? You got to figure out how to get your glutes to work apart from your thighs. Then you have to build up the glute strength. And once you can consciously control it just fine. And then walking needs to be fixed. This takes weeks or months. And the whole time, though, I'm telling the patient, you should be feeling better. And if you're feeling worse, if the pain's increasing, then something's not happening right. Now, let me clarify that part. If you feel like you took too many steps, like you walked a little too much, if you feel like you did an exercise and it started to engage your quads and then your knee started to hurt, or from walking your knee hurt a little much, then you know why it hurt. You know you overdid it. And that's okay. That doesn't mean stop our treatment. That just means you overdid it. You started using your quads, or you just did a little too much for what your cartilage can take right now. But if you know your limit now you can work within your tolerable amounts of strengthening and endurance, and it'll climb over time. What I don't think is right, what I would definitely advise you against, is if you're going on a walk or you're doing some exercise, whatever it might be, and you feel some pain come on, I wouldn't say keep going. I think that's a stopping point. Adjust your technique, adjust the resistance, like make adjustments as necessary. But if it still hurts, even though you adjusted, you need to stop for the day. That way you can come back tomorrow or the next time and you'll be just fine doing it then. But I would disagree that that you're going to feel pain as you let the cartilage breathe. It should feel better. The way I see that kneecap is it's being smashed up against the thigh bone. And just like if I were to smash my hand right here for hours, days, weeks, months, it would be painful under my hand. Right here, it would hurt where the kneecap is. As soon as you take that pressure off, it's got to be relieving. And by getting the quads to relax, you're taking some of that pressure off. By getting the glutes to work better, you're taking that pressure off and you're normalizing the pressures within the knee joint for chondromalacia patella. Hope that helps you, Brendan. All right, guys, I've got to wrap it up here. Pleasure hanging out with you guys. Thank you for being patient through our power problems. We still don't have power. Everything we're working on is operating on battery right now. Thankfully, we have that. But I'll catch you guys next week. Have a wonderful week.